Hey everybody, Dr. Osborne here. Welcome back to Monday night's Pick Dr. Osborne's Brain. We got a late start tonight, 6:30, running a little bit behind. But before we get started, we're going to be talking all about gluten in your mouth. Like, how does gluten affect your oral cavity? What are some of the signs and symptoms associated with gluten exposure? So maybe you're listening and you don't have a gluten issue or don't know that you have a gluten issue, but you've got all these mouth symptoms we're going to talk about. Possibility you might have a gluten issue. Also going to talk about some hidden gluten, how gluten can actually be found, or you can get gluten in the mouth as a result of dental work and other things. So we're going to talk and dive into that as well. So before we get started, let me know who you are. Let me know where you're from. Say hello to me. If you like these live sessions, let me know. Hit the like button, hit the share button. If you know somebody who can help from some of the conversations that we're going to be talking about again tonight is all about gluten in your mouth. So what are some of the ways that gluten in the mouth can manifest? And there was actually a study done. This was over 10 years ago. A colleague of mine ran a study. It was a random study on people with gluten sensitivity. And what they found was the number one, at least in this study, the number one symptom, oral cavity symptom of gluten exposure for people with gluten sensitivity issues was actually canker sores. So if you ever get what kind of looks like a fever blister, some people think that they're viral in nature. If you've ever had a mouth sore, canker sore, it's also sometimes called aphthous stomatitis. So if you go to the doctor and they say you have aphthous stomatitis, that actually is a canker sore. It's just a fancy way of saying it. But a lot of people with gluten sensitivity, that's the predominant symptom. In essence, gluten exposure, that's what is happening is they're having canker sores as a result of getting exposed to gluten. So if you suffer with chronic canker sores in your mouth, understand that that can be a viral infection, but it doesn't have to be. It oftentimes it can be associated with gluten sensitivity as well. So a lot of people will suffer with a type of herpes virus that can cause the same types of blisterations in the mouth, but understand that gluten can do it too. So if you are having those chronically and you don't know why, then you might ask your doc to test you for gluten sensitivity. I'm going to put up a little research study on that topic for you. So if you want to read more into gluten and canker sores, that you can. There it is. I just posted it in the feed. So many of you listening, if you want to go check that out. Oh, we got a few more chiming in. Wow, Peter, all the way from Malaysia. Welcome tonight, Peter. We got Monica from Orlando, Florida, and Marjorie says, I have a German Shepherd pup. You're going to love your German Shepherd dog. If you don't have a German Shepherd, or if you, again, I know we're not talking about dogs tonight, but man, I love my German Shepherd. They're such great dogs. They're such family dogs, and they just love endlessly. We've got Vernetta from Houston chiming in, my hometown, and Pamela's chiming in. Hi, Pamela. So again, canker sores, one of the biggest symptoms associated with gluten exposure. And again, in one study, it was the most common symptom of gluten exposure. So getting exposed to gluten, canker sores was the most common symptom in the oral cavity. And what I like about knowing about gluten in the mouth is that many people don't run the test, or the doctor won't run the blood test, or they won't do the genetic testing. So if you just pay attention to what's going on in the oral cavity, you can get a lot of insight into clues as potentially whether or not that gluten could be an issue for you. Let's see here. One of the other oral cavity symptoms, we did a special a while back and on the tongue, and I'm gonna put this up there for you too. I actually did a pretty lengthy video and showed a bunch of slideshow pictures of tongue manifestations of nutrition. And those of you who are not subscribed to our YouTube channel, that's actually archived there. But there are a number of manifestations of gluten-based tongue issues. And so one of them is something called glossitis. Glossitis is inflammation of the tongue. So what'll happen is your tongue should be nice and pink and fleshy colored. But a lot of people will develop a really almost like purplish red color on the tongue. And that actually can be a form of glossitis. It's inflammation on the tongue. And that's a very, very common symptom of gluten exposure. So if your tongue is super red, super purple, sometimes it's referred to as magenta tongue. that can be a symptom of gluten exposure. And one of the reasons why is that gluten causes malabsorption. So it creates vitamin deficiency. And so when the tongue is very swollen like that, it's a very, very common side effect of vitamin B deficiency. And again, vitamin B12 is one of the most common nutritional deficiencies in those with long-term gluten sensitivity. So look at that tongue in the mirror, and if it's super red or super purple, magenta in color, then you potentially might want to suspect nutritional deficiency. And again, that nutritional deficiency is possible that it's associated with gluten sensitivity. Let's see here. So a lot of you are starting to pop the questions in, and that's good. If you've got questions, go ahead and start putting them in, because I'll get as many answered as I can before the evening is over. Again, it's first come, first serve. So if you do have questions, make sure you chime in. And if you haven't told me who you are and where you're from, make sure you say hello to me. It's rude to come to somebody's house and not say hi. So make sure you say hello to me. Let's see here. I just plugged in an article for you too on glossitis. So that was the second big symptom that I wanted to share. So what are some of the others? One of the newer studies shows actually cavities and enamel issues. So tooth enamel issues are very common in people with gluten sensitivity as well. Again, it has a lot to do with the malabsorption and the malnutrition. So if you've been to the dentist, and this is particularly prominent in children. So if you've got your kiddos and you're going to the dentist and the dentist is saying that your kid's enamel, your child's enamel is eroding, or they have poor enamel, this is one of those things you might just want to suspect a gluten sensitivity issue. Enamel disruption can be caused as a result of gluten. So enamel issues in the mouth, if you're having a dental visit as well, not just enamel issues, but also cavity issues. If you have chronic cavities, recurring cavities, again, a lot of things that can cause cavities, gluten is one of them. We know gluten can cause a disruption in the microbiome and change and alter the type of bacteria in the mouth and in the GI tract. And that's one of the reasons why it can be linked to cavities. Of course, don't forget sugar. Obviously, sugar we know is one of those. But if you are not eating sugar and your diet's very clean and you keep going to the dentist and you are being told that your enamel is eroding and you're being told that you have more cavities than what you could possibly think you should have because your oral hygiene is very stellar, then you might consider gluten as a potential part of the issue. All right, more of you chiming in. Len from South Australia and Vanessa from Ohio. Hi, guys, gals. We got Diane from Missouri. We've got Karen Vala Gosel. Did I say that right? From Chicago, Illinois. Welcome. We got Melissa chiming in, and Mike from Mississippi, and Sergio Leone with googly eyes. I don't know where googly eyes is from, but hi, Sergio. Nice to meet you. Nice to have you on the show tonight. We've got Dorcas Bethany from Washington State, and Melanie from Houston, Texas, and Michelle Bates DePere from Vermont. Wow, all over the world, all over the country. Welcome to all of you this evening. We got Marjorie from the UK, and we got Maria from New York. Okay, so again, we've talked about canker sores. I'm getting behind on my screen here. We got canker sores, we got tooth enamel problems or issues, and cavities, as well as being signs of potential for gluten sensitivity. We've got glossitis, the tongue, glossitis. One of the other things that's common in gluten sensitivity is so the tongue can be swollen and red, but on the sides of the tongue, so the sides, the bilaterally, there will be like grooves. So you'll see almost like scalloping in the tongue itself. This also can be a symptom of gluten exposure or food allergy exposure as a whole. So it doesn't just have to be gluten sensitivity. It can be other foods as well. So if you have a scalloped tongue or if you have a really inflamed looking tongue, again, that both of those can be symptoms of gluten sensitivity issues. Okay, I'm going to post something else up because there was a recent study done, and this one is huge because there's a lot of different things that we're looking at in the mouth. So I'm going to go through a list of different symptoms, And if you have them, these are all potentially symptoms of a gluten exposure, and they all have to do with the mouth. So again, no testing necessary. You just look in the mouth. One of the things is called tonsil stones. So the way you would look for tonsil stones is you open up and say, really wide in the back. If you still have your tonsils, they're, right back here when you open up and say, there's those lumps of pink flesh on either side here. And sometimes inside you'll see like little white debris packed inside them. Those are called tonsil stones, or sometimes referred to as tonsillar exudate. And so this is one of those things that what that represents is it represents white blood cells infiltrating into the tonsils to fight the gluten as you eat it. So your immune system, your tonsils can swell. They can be packed with tonsillar exudate. And that in and of itself is just your immune system responding to the gluten that you're putting in your mouth. And so it's trying to fight. I see this very, very commonly, tonsil stones in people with gluten sensitivity issues. And one of the things that tonsil stones will do is they will cause a severity of bad breath, meaning that the biggest symptom, as far as what you are paying attention to is actually, aside from the presence and seeing them, it's just bad breath. So, if you're being told you have chronic halitosis or bad breath a lot, and you've already used the special toothpaste and the special mouthwash, open up, say, look for those tonsil stones in the back of the throat. Because if they're there's a good chance you're gluten sensitive, and cutting gluten out. And I've seen cases where cutting gluten out, boom, they went right away. Those stones, the immune system quit packing white blood cells into the tonsils to fight the gluten. So all that stuff kind of goes away and dissolves on its own when you're not eating things that you're reactive to. So tonsil stones, again, is a big, big finding, or a big, big problem associated, can be, with gluten exposure. Let's see here. Another one. So we said tonsil stones, and we said bad breath. Excessive mucus production. So if you are finding yourself after a meal, especially maybe you go eat a piece of pizza or you eat a Subway sandwich or something like that, right? And you're clearing your throat, just constant clearing of phlegm or mucus, this could be potentially a symptom of gluten sensitivity. Again, depending on what you ate. Excessive mucus production after a meal is a sign of potential allergy. So whatever that meal contained, you could potentially be reacting to that. Remember, you produce mucus. Your body produces mucus because inside your mucus, you make antibodies. These antibodies are called secretory immunoglobulin A. They're specialized types of antibodies that fight what you're putting in. So when you produce more mucus, it's actually a symptom that you're producing that mucus to make more antibodies to battle, that gluten exposure that's coming in. So again, be aware that is, another potential possibility. So if you have excessive mucus and phlegm clearing your throat excessively, these are, again, symptoms that you might be either gluten sensitive. Again, it can be food dependent. So I've seen it's very bad. A lot of people have it with dairy. A lot of people have it with gluten, and some people have it with other allergies. So it's not, I don't want to say it's gluten specific, but it can clue you in, especially if you're eating super clean and super clear, but you're going out and you're eating out at restaurants. This could potentially mean the difference between you getting cross-contaminated and knowing you're getting cross-contaminated or not. So another symptom is something called a cystic frenula. Now, all of you should have right underneath the top of your lip, if you lifted that up, there's a flap of skin right here in the middle. It's called the frenula, F-R-E-N-U-L-A, frenula. And what you'll see is it should just be a nice thin flap of skin connecting your lip to the gum line. But for a lot of people with celiac disease and a lot of people with gluten sensitivity issues, there's a little tiny cyst on that flap of skin. So it looks like a little fat ball, almost a little fleshy fat ball right there on that. That's called a cystic frenula. And so if you again, go in the bathroom, pull that top lip up, look at that flap of skin, look at that frenula. If you have a cystic frenula, that might also be a symptom of gluten sensitivity. And so, again, just more insight as to how you can use your mouth to look at whether or not there's a potential problem going on. Now, some of the other symptoms, one of the other symptoms, a big one, is a metallic taste in your mouth. So now metallic taste in the mouth doesn't have to just be gluten. Again, just like with some of these other symptoms, it's not necessarily just gluten that can cause them. But again, if you think you're gluten free and you're doing everything you know within your power to avoid gluten, but you have this persistent metallic taste in your mouth and you're eating out a lot, it could potentially mean you're getting cross contamination, or it could mean you're not really following the diet as well as you think you are. But a metallic taste in the mouth could also be, there are some people that have mercury-based fillings, so like the silver amalgams. There's some people that have heavy metal toxicity that have a metallic taste in the mouth as well. So again, this doesn't just mean gluten exposure, but it very well could be gluten exposure. So again, paying attention to that. If you have a metallic taste in your mouth, that could be a symptom of gluten sensitivity. Now, a few other things that can happen, and I've seen a couple of other things. One is we'll see in severe cases where gluten is affecting the stomach, and we'll see a reflux, like an acid reflux condition start to develop, where you get a black streak on the tongue itself. So there's a black, and then going down the center of the tongue, there's a black streak. Again, if you have acid reflux, you've got that black streak. That's another potential possibility that your acid reflux is actually coming from gluten irritating your stomach lining, creating that reflux, leading to that black discoloration of the tongue. So, again, if you look at the tongue, there's a lot that it can tell you about what's going on intrinsically. So again, black streak on the tongue. Let's put that away. Looks like these questions are coming in. So let's see if we can get to a few of them. So interesting. So Adam's chiming in. I had canker sores, but it was due to nighttime acid reflux. The question is, Adam, did you have canker sores due to nighttime acid reflux, or did you have nighttime acid reflux that was causing canker sores because you were gluten sensitive? Again, no, I can't say that that's what was happening, but be interesting to know if you are following the no grain, no pain diet, the no grain, no pain protocol, if that clears up or if that had cleared up. So if that's the case, let us know. Let us know if that is what is happening to you. Those of you who are listening tonight, if you haven't heard of no grain, no pain is my basically, it's my magnum opus. It's my book. It came out last year, and it's all about going gluten-free. It's all about grain and how detrimental grain can be. And it's not just about gluten. It's about so many more things. But again, if you want to take the most out of the Pick Dr. Osborne Brain Show every week, reading that book will give you a really good platform of understanding about what we're talking about. Let's see here. I like this question. Can gluten affect emotions? Absolutely, it can. Gluten can definitely impact emotions. There's actually, Vanessa, one of the original names for gluten sensitivity is called bread madness. Bread madness. Think about that for a minute. This was schizophrenia. And so what would happen in hospitals, that schizophrenic patients would get fed bread and their symptoms would exacerbate. They would get even worse. We know that gluten we know in the medical literature and in clinical science, gluten has been linked to schizophrenia. It's been linked to bipolar disorders. It's been linked to depression. So to answer your question, absolutely can affect emotions. Let's see here. Brigida from San Jose, California. Hi, Brigida. Welcome to the show tonight. Maria, I think we had her from New York. Yeah, thank you, Maria, for chiming in. So here's another one. I have anemia. Should I blame gluten for poor iron absorption? You can, but whether or not it's the cause, there are a lot of reasons you can have poor iron absorption. We can talk about a couple of those. Gluten is definitely one of them. As a matter of fact, most research, I think it's 67% of all people with celiac disease have iron deficiency. So, yeah, I mean, it's a very, very common manifestation of gluten exposure because gluten can damage an area of the stomach and an area of the small intestine that's responsible for where iron is absorbed and broken down. So iron deficiency is a very, very common cause of anemias. And a lot of what happens to a lot of people is they get diagnosed with an anemia. Their doctor says, yeah, you're iron deficient. When they're young, and they just battle iron deficiency for years and years and years, and they can't give blood, and they keep having to go on infusions or oral iron supplementation. And it turns out, that goes on long enough and they end up with a diagnosis of celiac disease. It's just that celiac damage didn't show up earlier on in life. It was just causing damage that led to the iron deficiency. So if you've got chronic iron anemia, iron deficiency anemia, absolutely you should be checked. And gluten sensitivity should be ruled out because they're highly, highly correlated. Now, some other things can cause iron deficiency. Low stomach acid production can cause iron deficiency. Taking antacid medications like Protonix and Prilosec even some of the over-the-counters like Tums, Rolaids, Pepto-Bismol. Remember, all of those neutralize stomach acid, and you need stomach acid to absorb iron. So, definitely more than one thing can cause iron deficiency. But good question. Thanks for chiming in, Dorada. Yeah, Marjorie's chiming in. Does gluten affect your gums? It can. And a lot of other things can affect your gums, but receding gum lines, there have been a few research studies that have linked celiac disease to gum recession. So it absolutely can affect your gum lines. Here's a good one. Michelle from Vermont, 3.5-year-old tongue. My 3.5-year-old's tongue looks like it's fuzzy white, kind of, and had white bumps. She had a cavity and she's getting dark circles under her eyes. I have a ton of food allergies that just developed a couple of years ago. I've had US Biotech and she's getting tested next week. Yeah, it's very possible that's allergy response. It's also possible she's got a yeast overgrowth. It's very, very common to see that white fuzzy discoloration on the tongue with the presence of a yeast overgrowth. So you might just ask the same doctor who's running your testing to also look at potential for yeast. And I'd also have them run what's called an IgE allergy test, a comprehensive IgE test, because sometimes you find subacute responses that are not picked up on a delayed food test. Let's see here. Denise, thanks for chiming in. Denise from Nebraska. Been told I have fructose malabsorption, and having SIBO also have the gene associated with gluten problems. I've had canker sores prior, along with tongue issues, which told it was burning mouth syndrome or scalding mouth syndrome. So, but the big question, Denise, is why? Why are those things happening? And that's, in my experience, when somebody has scalding mouth syndrome, it's almost always linked up to heavy metals, or it's almost always linked up to mold exposure, or something called Marcons. Marcons is a type of bacterial infection that gets in the nose and lives in the sinus cavities, and it can create that same type of problem. So you might just ask your doctor to culture your nose. You might also do an inspection around the home and make sure there's no mold. Swollen lymph nodes. Yeah, Michelle's asking, as swollen lymph nodes, can that be a sign of gluten sensitivity? Absolutely, it can be. It's not in the mouth, but yeah, you can have swollen lymph nodes. Again, the swollen tonsils in the mouth. We can get swollen cervical chain lymph nodes along the sides here and in the clavicular regions, which is right above your collarbone. So a lot of times people will start to develop swollen lymph nodes. I've actually even seen people develop swollen lymph nodes under the armpit. So we'll get swollen nodes under the armpit as a manifestation of gluten sensitivity. Let's see here. So Marianne's asking, canker sores possibly gluten, but what about fever blisters on the outside of the lips? Yes, fever blisters on the outside of the lips can also be manifest as a result of gluten sensitivity. But it doesn't, again, it's not explicit to just that. You can have fever blister on the outside of the lips for other reasons as well. And again, one of them can be a viral infection or other types of infections. So that's also a possibility. Hey, Melanie, chime back in here. How do you get TS out? You're abbreviating TS, and I'm, want to make sure I understand what you're using that abbreviation for. So chime in and let me know what you mean by that. Thank you, Michelle, for your praise. I'm glad you're enjoying the show and finding value from it. On that note, make sure you share it with somebody who would also find this information helpful and amazing. Let's see here. Yeah, IgA deficiency. This is a real common cause. This can be a real common thing with people with gluten sensitivity issues, is IgA deficiency. It's part of it is because if you're attacking gluten every day, if you're gluten sensitive, and part of what your immune system is doing is expending IgA to attack that gluten over time. Remember, your immune proteins are not endless. You can start to tax your immune system, and IgA deficiency is one of the longer term consequences, or can be, of chronic gluten exposure. Yeah, so Dorcas is asking, would the cystic frenula go away once you go off gluten? Yes, it can. I've seen them go away, absolutely. Now, again, gluten is not the only cause of cystic frenula either. There are other foods and there are other gastrointestinal problems that yeast overgrowth can cause that too. So you need to make sure that if it's not going away and you are truly gluten-free, meaning not just wheat, barley, and rye-free, but gluten-free, the way I talk about gluten-free and no book, no grain, no pain. And if you are and the frenula doesn't go away, then I would get with the doc and have them look at your GI tract and make sure there's nothing else happening or going on. This is great, the praise you guys are giving. I'm just so glad you're taking away and walking away with useful information. So thank you, Wanda, again, for acknowledging that. Gluten and joint pain from RA. Yeah. Gluten is a very notorious trigger for autoimmune disease. Rheumatoid arthritis, or RA, is just a form of autoimmune disease. And again, there are different triggers for autoimmunity. There are 4 predominant triggers: food, chemicals, infections, and the 4th trigger is nutritional deficiency, or can be. Those are the big ones that you can control and that you can change. And so if you are suffering with RA and your doctors haven't looked at gluten, that would be one of the first things I'd ask them to look at. Okay. Yes, Maria, thanks for chiming that in. Some acid reflux pills do contain gluten, so you've got to be careful. Always, if you're gluten sensitive or celiac and you haven't done an inactive ingredient check on your medications for potential for gluten exposure, that's one of the first things you should do. Thank you for bringing that up. Okay, book name again. No Grain, No Pain, Linda. So again, those of you who are listening, again, maybe for the first time, the book is No Grain, No Pain. And if you buy it, I want to give you a free gift. So it just helps you use the book better. Make sure you send that receipt wherever you buy it, whether that's Barnes & Noble or Amazon or wherever. It's published all over the country, all over the world, actually. So wherever you buy it, send a receipt to us, and we'll give you a free 60-some-odd page leaky gut manual with it's just chock with powerful information that might also help you beyond the book. So make sure you send us that receipt. And if you go to nograinnopainbook.com, you can actually put your receipt number into that website, and we'll get you that free information as well. Yeah, omeprazole. So Julene, if you're on omeprazole, you should understand that omeprazole blocks magnesium, blocks calcium, blocks iron, blocks zinc, blocks vitamin B12. So if you are not having those nutritional parameters checked, you want to definitely get with your doctor and ask him to measure for those deficiencies, because the long-term consequence of those deficiencies can affect and impact your health in a multitude of variety of different ways. And that, I've seen the antacid medications really predispose people to chronic infections and to severe malnutrition. Remember, if you block stomach acid, I said magnesium, I said B12, I said calcium, I said iron. You need all that to build bone. A lot of people that block stomach acid long enough end up getting a diagnosis of osteopenia or osteoporosis. So you definitely want to make sure, if you're on those meds, that you're having your doctor check your nutritional status. Karen is asking, is there any one specific site that you recommend for a person fairly being diagnosed with celiac disease? Yes, there is. As a matter of fact, the best website in my opinion, in the world is glutenfreesociety.org. And I'm going to put that right up there on the screen for you, glutenfreesociety.org. If you go there, sign up for the newsletter that we publish, and we'll send you a gluten-free survival kit. It's everything you need to know as you're getting started into the realm of going gluten-free. And it's everything that you need to know that probably the doctors that diagnosed you won't tell you about, because a lot of them just gloss over the diagnosis. Say, yeah, you're gluten sensitive, you need to avoid gluten, and then they just kind of leave you to fend for yourself. So go sign up for Gluten-Free Society's newsletter, and you'll get more information than you know what to do with, but it'll be extremely valuable and extremely helpful for you. Okay. Yeah, idiopathic small fiber neuropathy. There's actually a lot of research on peripheral neuropathy and gluten as a cause of neuropathy. So it doesn't surprise me one bit, Kelly, to see that that with you. Does gluten cause leaky gut, and is leaky gut curable? So first of all, let's define what that is. So curable would indicate that leaky gut's a disease. Leaky gut is not a disease. It's a transient state of the GI tract. So I wouldn't call it a curable thing. I would call it a preventable thing, or I would call it something that you could resolve. Does gluten cause it? It can. Gluten is one of the predominant known causes of intestinal hyperpermeability. Michelle, if you go to glutenfreesociety.org and type in leaky gut, causes of leaky gut, you'll find several expert interviews with some of the world's leading researchers on leaky gut, including one with a Harvard researcher by the name of Dr. Alessio Fasano, who I interviewed a few years back. And we talked in depth about leaky gut, but you'll find a lot of information about some of the other things that we know can cause leaky gut as well. Here's one. Aaron saying, my son gets canker sores with gluten. I told allergist and skin and blood tests were negative, but when he is gluten-free, he doesn't get them. He also had low iron. I think his guts weren't absorbing due to damage, clear intolerance. He's only 9. Yeah. So again, the skin test's not accurate, not for gluten. The blood test's not accurate, not for gluten, not unless the damage is that severe, super duper severe. If you're going to get accurate testing for gluten sensitivity, you absolutely want to get genetic testing done, not 23andMe, not some of these other tests where they're running these mass array panels of genetics. Those tests are not going to tell you. They're only going to tell you whether you have certain SNPs, but they're not going to tell you whether you have the gene pattern for gluten sensitivity in a comprehensive fashion. So you've got to get genetically tested appropriately. I'm going to put a link in here for those of you who are interested in learning more about genetic testing, because don't settle for blood tests. It's not going to give you an answer. It's, it's notorious. We know blood testing is highly inaccurate. It's accurate if it's positive, but it's not accurate if it's negative. And so a lot of people will go and get the testing done, and they'll have what we commonly refer to as a false negative test result. So genetic testing, I'm going to put a link up for genetic testing for gluten sensitivity. And if you want to go learn more about it, there you go. It's in the feed, and you can go check that out. Okay. Is there anything you can do if you accidentally get gluten? Yeah, actually, I did a video I did a show on that very topic. It was probably about 2 months ago, Dorcas. Go to our YouTube page, youtube.com/glutenology, and it's there and it's archived in our shows. So what to do if you get gluten, and we talked about it for about an hour. So I won't answer that question in detail because I've got a full show that we dedicated to that. So make sure you go subscribe to our Glutenology channel on YouTube. Let's see here. Would I comment on corn-based products used in making retainers for teeth? Man, you were taking the words right out of my mouth. As a matter of fact, I've got a beautiful study here on that very thing I'm going to put up in the feed. Yeah, so here's one of the things. So a lot of retainers, they're using corn-based adhesives, and in some cases wheat-based adhesives. And there's some research showing that some people, especially those with celiac disease, when going to the dentist, having that retainer put in, they're getting cross-contamination from the retainer itself. And those of you who are hearing about corn for the first time, if that's like blowing your mind, like, what do you mean corn? Corn's gluten-free. Go read No Grain, No Pain. I talk all about the types of glutens that are found in corn, because again, it's common practice that most people don't even realize that corn contains forms of gluten that can create damage in people with celiac disease. So they continue eating corn-based products and they continue maintaining their illness. So if this is the first time you're hearing it, please go read it. It can save your life. Most people with gluten sensitivity go on to continue to struggle with health issues. And a lot of those health issues are autoimmune conditions. The average person with celiac is going to go on to develop multiple forms of autoimmunity unless they get it right. So again, I wrote no grain, no pain to help you get it right. Kelly's chiming in also angular cheilitis. Yeah, angular cheilitis is actually, it's when you get the cracks in the corners of the lips right here and you open your mouth and there's like cracks and there's can be bleeding. Angular cheilitis like that, though, more commonly it can be caused by gluten sensitivity. So I'm glad you chimed in here. But the reason it's caused by gluten sensitivity actually has to do with iron. Iron deficiency causes angular cheilitis. So does vitamin B2 deficiency. So again, the malnutrition as a result of gluten exposure are directly linked to those oral findings, to that finding in the mouth. Oh, TS is tonsil stones. So, okay, so coming back to what was TS earlier. Yeah, I think I answered that question then because I talked a lot about tonsil stones. Do I ever encounter loss of oral tolerance in people eating a severely restricted diet? If you mean, do I encounter people who become more and more allergic to more and more and more things? Sometimes, but usually it's not as a result of having a severely restricted diet as much as it's a result of a lingering environmental issue that's continuing to hammer their immune system so that they're not capable of getting better. And in my experience with that, with continued loss of oral tolerance, there are a few big ones that we'll see. One is mouth work, so dental work, whether that be like root canals with hidden infections. Some cases it can be like the amalgams, the silver amalgams. In other cases, we'll see mold in the environment, so they live in a moldy environment or a moldy home, and they're being chronically exposed to higher levels of mycotoxins and molds. In other situations, it's because they think they're on the right diet, but they're not on the right diet. So they think they're gluten-free, for example, but they're still eating corn and rice and other grains. And in some cases, it's because the food that they're eating is, even though it follows the right rules, it's still highly processed and their body just doesn't do well with processed food. So there are a lot of different reasons why we might see that happen, but it's very, very rarely is it because the person is just becoming more allergic per se. It's just that what they're eating or what they're being exposed to is just continuing to confuse their immune system. Okay, let's see. And I love that you guys are talking to each other in this feed too. So a lot of you are chiming in and answering some of these questions. And so thank you for being so proactive in the feed. I love that. I love seeing that you're interacting with each other. This is a great place to meet other people who are struggling as well, and making friends that can, kind of help you navigate some of these waters. And those of you who aren't part of our private Facebook group, I have a private Facebook group called Dr. Osborne Support Community. If you're not a part of that, go look it up on Facebook, and all you have to do is submit to join. But we have that there, for people who are reading the book and just want to support community, and want other people who are going through similar things to just talk to, or to just run ideas by. It's there to serve you. We want to help you. Here we go. Denise, me again. 95% gluten-free for years. GI doctor has me eating gluten since December to test further on gluten. Since eating it again, notice pimples, heartburn, high blood pressure. Doctor says since having some reactions to gluten, okay, due to additional testing now. Do you feel that 3 months on gluten again? Look, Denise, the testing that the GI doctor wants to do is probably a biopsy. Understand the inaccuracy of biopsies are notorious. Your intestine's 22 foot long. The surface area is as big as a tennis court. A biopsy is a microscopic cross-section of a tennis court. Now, if the biopsy comes back positive, you're lucky, you found it. But if a biopsy comes back negative, poor you didn't find it. But here you are going through 3 months of feeling horrible and having symptoms, so that the doctor can confirm what you already know, which is you feel bad when you eat gluten. If you really want to know about gluten, go back and follow that link I posted just a moment ago on genetic testing. You want to know, you don't have to eat gluten to get genetically tested. If you have gluten-sensitive gene patterns, you avoid gluten unless you want to become sick. So, you don't have to bother with eating gluten to get a test and to get a confirmation. You can just run the proper genetic testing. Okay, let's see here. So the testing I was talking about for mold, the first test is it's a preliminary starter test. It's called an ERMI, E-R-M-I, and it stands for Environmental Relativity Mold Index. And that particular test is a dust test that you could do a dust collection in your home, and you're measuring for different types of mold spores and their concentrations in your home. It's the first best place to start if you suspect your home has mold. Which came first, the MS or the celiac? Yeah, Chrissy, thanks for chiming in. It doesn't matter. Honestly, which came first, the chicken or the egg? It's a rhetorical question that can never be answered. And answering it is not really relevant because they're both autoimmune conditions. And, I've seen cases where people had celiac for years and developed MS, but they didn't really have MS. They had vitamin B12 deficiency that was so severe because of the celiac. So I've seen celiac be the proverbial chicken and MS being the egg, if you will. But I've also seen it in the other direction. I've seen people with MS who had MS for years and became debilitated and then found out that they had celiac disease. So again, to me, those questions are redundant questions that are rhetorical in nature and don't serve anybody figuring out what to do next. What really serves people is looking for the triggers of autoimmune disease. And the triggers, very simply put, the triggers are foods, chemicals, infections, and nutritional deficiencies. And if you have those things and you know what those things are and you have those things analyzed, you can go a long way to helping, resolve an autoimmune issue. So can gluten autoimmune be responsible for tumor growth in the thyroid? Yes. Very simply put, yes, it can be. Not in 100% of cases, but it certainly can be. Dorcas says, I know they say 1 in 100 have celiac, but do you think the stats of people who have gluten sensitivity? So that's not correct. 1 in 100 may have celiac, but how many people have autoimmune disease that's gluten-induced that don't have celiac? I think that's maybe what you're asking. And the estimation there is about 30%. This is much, much higher. We could actually say that celiac disease is a more rare manifestation of gluten sensitivity than a lot of the other forms of autoimmune disease. So it's just that it's the one that we discovered first. So it's the one that gets the most press. Supplement recommendations for malabsorption due to damage from gluten or specific testing. Yeah, specific testing, you just got to ask your doctor for what's called lymphocyte proliferation testing. You want to look inside the blood cells and make sure that your nutritional storage over time is high enough, because that's where people run into trouble. As far as supplement recommendations for malabsorption, if you're looking for for digestive support, the one I recommend, there are a couple different ones that I personally formulate. One is called Gluten Shield, and the other is called Ultra Digest GB. And I will preface those by saying, if you have, if you're traveling, if you're eating out a lot, Gluten Shield is really, it's not designed to allow you to eat gluten. What it's designed to do is it's designed to protect you from the potential of cross-contamination, but it's not designed to give you permission to eat gluten. But it also is a digestive enzyme, so it's there to support digestion. So it's one of those things that you can use. The other, and I just posted that in the feed for you. The other one is called Ultra Digest, and you can look that up as well on Gluten Free Society's website and find more information about it. This question, people with celiac, should we have iron and androgens checked? Missy, you should have every nutrition deficiency checked for. So iron and B12 and folate and B5 and all the B vitamins, right? The chromium, the selenium, the copper, the zinc, the magnesium, the calcium, the iron, all of those should be checked as a minimum on an annual basis, because with celiac disease, you could have potential refractory nutritional problems where even though you're grain-free, gluten-free, you still have villus atrophy. It didn't fully heal, and so you still struggle with malabsorption. So you should have ongoing nutritional checkups with your doc. As far as your androgens, if you suspect androgen deficiency or androgen toxicity, some people have hyperandrogen levels, so they have too much testosterone or too much androstenedione and some of the other precursors to testosterone. Yeah, you can have them checked, but just because you have celiac doesn't mean that you have to, or you should have them checked. Okay. So could gluten be responsible for calcium deposits I'm finding in my hands? So first of all, Jennifer, I don't say this in a mean way at all, but you're making an assumption that those are calcium deposits, and they may not be calcium deposits. So can gluten cause nodule formation, and what looks like nodules forming in the hands? Yeah, there are forms of autoimmune arthritis where there are nodule forms, and they kind of feel a lot like calcium, but they're technically not calcium. So I just say that because I don't know whether you have calcium deposits in your hands, and a rheumatologist could tell you that or answer that question for you if you're seeing one. But gluten can cause the nodule formation in the hands. But again, the debate is whether or not they're actual calcium versus other types of tissue. If I take control of gluten intolerance, is it possible that Hashimoto or hyperthyroid will go away? I've seen it happen, Maria. It doesn't happen for everyone because there's more than one cause for Hashimoto. But for a lot of people, going gluten-free is very, very much the right move, and it dramatically improves their thyroid antibody production. Like if your doctor is monitoring if you've been diagnosed with Hashimoto's, they usually will monitor the thyroid peroxidase antibodies and the anti-thyroid globulin antibodies. So go gluten, if you're going gluten-free, again, true gluten-free, meaning Follow No Grain, No Pain, Chapter 7, Chapter 8, and have your doctor monitor your thyroid antibody levels. And if you're like most people that I've seen, you'll see your levels dramatically start to drop. So the answer to that is yes, it can be very, very effective and helpful in people struggling with a thyroid problem. So Dan is following No Grain, No Pain and just getting started with it and wondering whether or not migraines, ocular migraines in this case. Migraine, look, let me share a story with you. I can tell you that there are a number of times where gluten-free diets resolve migraines. Now, gluten is not the only migraine trigger, and I want to be very clear that, a lot of you may be listening and think, oh, gluten is a catch-all for every disease, and it's, if you go gluten-free, everything gets healed and everything gets cured. That's not the case, and that's not really why we're having this talk, and that's not what I'm trying to say. I just want you to understand that if you have these types of conditions and you don't know why, and it's like a medical mystery, gluten can contribute to inflammation. Chronic inflammation creates a lot of different kinds of diseases, and that's why gluten can be linked to so many different types of problems. But back to Dan's question, which is, can it be associated with migraine? I've seen it be the case in a number of times. I had a patient one time spend $80,000 over the course of a year in emergency room visits for migraine headaches and go gluten-free, and within 2 weeks, never spend another dime on the ER. So yes, to answer your question, I've seen that be the case, but there are lots of triggers for migraine, and gluten is just one of them. If you, again, go to Gluten-Free Society and type in migraine triggers, and there's a really beautiful infographic that you'll pull up on all the different types of triggers that can be associated with migraine-based headaches as well. So maybe gluten is a right move for you, but maybe there are some other things you might want to look at that you could learn as well. Let's see here. So I get a lot of people asking about calcium deposits, and look, if it's a true calcium deposit, again, it's very, very important that you know whether it's calcium or whether it's not, because there are a number of different medical conditions that can mimic calcium deposition. There's a condition called crystal pyrophosphate deposition disease, which can look like calcium deposits, but it's not. So again, there's clarity within having the right doctor, seeing the right doctor, getting the clarity in the diagnosis. So another reason why we might see calcium deposits in people's tissue is because of a parathyroid disease problem, and that very commonly can be caused by vitamin D deficiency or a lack of sunshine. So there are several different things, and my advice to you, if you are sure that it's a calcium deposit, go talk with your doctor and ask if they'll check your parathyroid gland, ask if they'll measure your 25 hydroxyvitamin D levels, and make sure that that's not part of the issue and why your body's depositing calcium in tissues beyond your bone. Okay, let's see here. I'm going to answer one more question. Anne is asking, I've been gluten-free for many years and still suffer with inflammation. What else can I do for inflammation? I also take prednisone. You've got to figure out where it's coming from. And so simply put, again, go back to your doc, ask them to run food allergy testing, both acute and delayed testing. Ask them to run nutritional deficiency testing because nutritional deficiencies can cause inflammation. Heck, vitamin D deficiency can cause inflammation. You also want to make sure that you're having your doctors look at other environmental factors that can trigger, would be things like food additives, food preservatives, that you might be being exposed to within your current diet. Pesticides, so if you're not eating organic, can also be common triggers for persistent inflammation. So again, a number of different, that's a big question, a number of different variables there, but I would start with a good solid functional medicine doc and really just start looking for, some of those reasons that inflammation can occur. But those are some places to start. Again, food, nutritional deficiencies, environmental chemicals, food additives, food preservatives, pesticides, really first very common sense places to start looking, because those things can be changed today. Those things, once you find out what they are, they can be changed immediately. Okay, so I'm out of time. We've got more questions, but I'm out of time. So if you enjoyed tonight's show, you know what to do. Next Monday, we will be back for another episode of Pick Dr. Osborne's Brain. So in an effort to take care of you guys, let me know what your feedback is. If you've got questions you'd like to see me cover, topics you'd like to see me cover, email me at glutenology@gmail.com, and we'll entertain whatever the requests we get back the most. So let me know what you'd like to see us cover for future shows. I'm happy to cover those things and help you. Let me know where you're struggling. And also make sure you share this with somebody. Again, this information, so many of you have chimed in tonight saying how valuable this information was. Now imagine if we could spread it. Imagine if we could just reach out and spread this information to 10,000 more people who are struggling. So let's help everyone. You're getting help tonight, so help me help other people by spreading this information. So hit the share, hit the like, and disseminate this to your friends, family, and loved ones who might need this help. And again, if you haven't, go to NoGrainNoPainBook.com, pick up a copy of No Grain, No Pain. And if you also haven't, make sure you subscribe to our YouTube feed at Glutenology, and make sure also that you sign up for our newsletter at glutenfreesociety.org. Have a great evening. We'll see you next week. This is Dr. Osborne. Take care.